for 10. This week what we're going to be focusing on is quality control and quality assurance. So that's going to be Chapter 6, pages 129 through 132, and Chapter 44. So let's get started. Let's talk about Chapter 6 first. So Chapter 6 really focuses on quality medical care. So that's an expectation that we set for all of our patients and requires that healthcare teams use procedures and techniques that result in the best possible outcome for that patient. Okay? This is done through what we call a quality assurance program. And that program is really a system that consists of reviewing records and maintaining them by the staff. The basic components of a quality assurance program are establishing a quality assurance committee, setting specific people that are going to work on this committee, reviewing all clinical and administrative services and procedures that take place. Are they in the best interest of the patient? Setting up a structure for identifying new reviews. So making sure that that team sets up, okay, this is how we're going to start doing this, this is how we're going to review this, things like that. And quantifying all issues. So for example, you want to tell patients about the average wait times or figure out what the average wait time is. The number of errors in a patient's record. Okay, that's something that we have to figure out and kind of get an average of what that is. The number of insurance claims that get denied and the number of failed blood draws. Okay? You will want to limit the number of issues that you possibly can, so that's what the program will do, and it will maintain a careful record. Your role as a medical assistant in this quality assurance program is going to be trained in both the clinical and the administrative skills. So you want to have both of those and have the ability to perform those at the highest level possible. Okay? So you always want to give your best at everything that you're going to do. Remember, patient satisfaction is a key element to a quality of care. If patients aren't happy, they will not stay with that doctor. So that's kind of that chapter, all kind of in a little nutshell there for you. Let's talk about Chapter 44. So this chapter is really going to focus on the difference between a quality control and a quality assurance. The first thing that we really need to do is be able to identify what is a quality control. Let's start there. So a quality control is a process of gathering and evaluating information about the services provided and comparing this information to what is an accepted standard or an accepted normal, an accepted benchmark. A quality control is going to be focused on the physical proof that results are accurate. Okay? This can either be a qualitative, a quantitative, or a semi-quantitative control. Qualitative results are going to be results that are either positive or negative. Okay? Think about a pregnancy test. You either get a yes or you get a no. That's a qualitative. This type of control will use results that are proven to be a normal. Okay? Quantitative, on the other hand, is something that's going to give you a numerical range or a reference value of what is acceptable. Again, you're going to use probably a liquid control to determine that range, and that range will already be preset by the manufacturers. And the last one is a semi-quantitative. And this is really where you're going to use a test strip of some sort to determine results. Those test strips are going to have probably a chemical pad that's already impregnated with that chemical to analyze it against your specimen to see if it's present or absent. Okay? Alright, so again, another pretty short video for you this week. It's going to be easier in class this week because we'll spend a lot of time doing those things. Please make sure, as always, you read your chapters in full prior to coming to class so you're prepared for what is to come. This week in lab, we will be performing those 3 types of quality controls. We will be doing them on various machines throughout the lab, so you kind of get to see some of the equipment that you'll be dealing with in quarters to come, not previous quarters. We'll also be practicing some vital signs, so you make sure you have all your equipment this week, blood pressure cuff, stethoscope, watch, your pens, your logs, all the things that you would need if you were actually working in the field. Your discussion post this week is based on procedures and biohazardous material. You will need to research a specific procedure, something maybe like a pap smear or a biopsy, something to that nature. That procedure should be one that may contain some sort of biohazardous material. So blood, bodily fluids, anything that comes out of the body. Okay. What you want to focus on is, describing the procedure itself and how you properly dispose of the biohazardous materials that get used, but also how you clean the area where that procedure took place. If there's any follow-up that is needed after the fact of cleaning up on those biohazardous items, you should discuss how that happens as well. Please make sure that your initial post is submitted by Tuesday at midnight with your 2 responses on Saturday by midnight. And then lastly, let's talk about your written assignment for this week. So your written assignment is going to deal with rules of disposal and disinfection. It's going to seem very similar to that of your discussion post because, again, you're going to identify a biohazardous source, explore how that item should be properly cleaned up and disposed of, but you also want to go a little bit further into that. You want to research what happens after the disinfection takes place, where that procedure took place, how you disinfect it. But you need to identify a local service that is used here in the Rockford area that's contracted to come pick up those biohazardous materials, and then how they follow up and dispose of those. So please make sure you have that in there as well, because that's a very important piece to this paper. Your paper should be about 2 to 3 pages in length, proper APA format as always, and if you want to see what I'll be grading you on, your grading rubric can be found in your calendar entry for this week, under the due date for it. Alright guys, that's really all I have for you this week. If you have any questions or concerns, please bring them to class on Wednesday, and I will answer them the best I can. If you need to know before then, shoot me an email. You know I'm always going to respond as quickly as I possibly can, and I'll help you in any way that I can. Alright guys, have a wonderful week, and I will see you on Wednesday. Bye!